Diabetic nephropathy, also known as diabetic kidney disease, is a chronic loss of kidney function. It occurs when high blood glucose levels damage kidney function. Diabetic nephropathy is the leading cause of chronic kidney disease, CKD, and end-stage renal disease, ESRD. It affects approximately 1/4 of adults with diabetes in the United States. It is a serious complication that affects people with diabetes, and is associated with an increased risk of death, particularly from cardiovascular disease. Symptoms: 1. Frequent urination at night. 2. Tiredness. 3. Headaches. 4. General feeling of illness. 5. Nausea and vomiting. 6. Frequent daytime urination. 7. Lack of appetite. 8. Itchy skin. 9. Leg swelling. 10. Swelling of the hands, feet, and face. 11. Trouble sleeping or concentrating. 12. Poor appetite. 13. Weakness. 14. Itching and extremely dry skin. 15. Drowsiness at end-stage kidney disease. 16. Abnormalities in the heart's regular rhythm, because of increased potassium in the blood. 17. Muscle twitching. Risk factors. Risk factors for developing diabetic neuropathy include: 1. Poor control of blood glucose. 2. Uncontrolled high blood pressure. 3. Type 1 diabetes mellitus, with onset before age of 20 years. 4. Past or current cigarette use. 5. A family history of diabetic nephropathy. 6. Certain genes have been identified that are associated with diabetic nephropathy. Treatment: 1. Early treatment delays or prevents the onset of diabetic nephropathy or diabetic kidney disease. 2. Regular outpatient follow-up is key in managing diabetic nephropathy successfully. 3. Smoking cessation. 4. Hemodialysis and eventually kidney transplantation to replace the failed kidney function. Prevention. 1. Appropriate education, follow-up, and regular doctor visits are important in prevention and early recognition and management of diabetic nephropathy. 2. Reduce the risk of developing diabetic nephropathy by controlling blood glucose and blood pressure levels. 3. Quitting smoking can help prevent diabetic nephropathy. Diabetic nephropathy, or diabetic kidney disease, is a serious complication that affects people with diabetes. It is the leading cause of chronic kidney disease and end-stage renal disease, and it is associated with an increased risk of death, particularly from cardiovascular disease. Early treatment and prevention can help delay or prevent the onset of diabetic nephropathy. Regular follow-up and management are key in preventing and managing diabetic nephropathy.